as a parent with this hopeful outlook, it's like, this is a treatment. No, it's not. It's not a treatment. This is a trial with a hopeful treatment.
It's our natural position to be optimistic and hopeful, but these are experiments.
I did all of my research and I knew all of the risks and I knew all of the potential benefits, and it was what was available to him.
And there was definitely that pressure. I have felt that something is better than nothing. But the way I articulated that at the time, and it was the final, okay, are we doing this? Is this a go? Are you sure? You know, any final questions or comments? And I can remember saying to the doctor, I would rather regret trying than regret not trying.
I think parents often feel very burdened with that decision, which is completely understandable. But I think looking at the facts, understanding what the course of the disease will be naturally, what the potential hope and expectation is if a treatment were to work, what the scientists, what the companies, what the researchers are hoping it will do, that balance is really where that decision lies.
Anytime you hear about a trial that you're interested in for your child, and then it turns out those rules are keeping you from participating, you sort of feel like that's, you sort of feel left out in a way that cannot feel good.
It's obviously important for you as a mother and for your family and your child to be on a clinical trial, and that's all you're kind of thinking about. But at the end of the day, the trial is for the greater good. And, we can't risk the outcomes of a trial for the benefit of a single kid. And it's a very difficult thing as a parent to consider that.
You can still have the hope, but you have to balance that with the realistic expectation that research is learning. Research is never definitive, and that is a very hard decision for anyone to make. But in fact, it's the only thing that will ever get us to having approved therapies, are people taking those chances and risks and doing so in an empowered and really in an educated way.
I think it's important to remember that the reason that there's a clinical trial is that they don't know what's going to happen.
Everyone who participates in clinical research is a pioneer and is a medical hero in my book.
We're optimistic, which is great because historically you're generally not optimistic with a disease like this, and there's other stuff coming down the pike. So enzyme replacement therapy might just be a part of other treatments that he will be getting down the road, such as, hopefully, fingers crossed, gene therapy that they're working on right now. There's hope for us. We have hope, and other families have hope. Even if it doesn't work out, maybe they get something from this that helps other children.